morning, everyone, and welcome to the Southside Healthy Community Organization's July 2024 Town Hall meeting. We have a lot to share this morning from a number of different voices, and I am always excited to talk about our work together toward building healthier lives and reducing health equity gaps on the South Side of Chicago. My name is Kimberly Hobson, and I am the CEO of the Southside Healthy Community Organization, which we fondly call the SSHCO. Every town hall that we host, we have new people in attendance, which is what we want to spread the word about the services we provide and how people can access them. So let me take a couple of minutes and remind everyone of who we are and why it matters to you. It starts with our main goal, our North Star, which is to help people live their healthiest lives and work to change the inequitable health statistics on the South Side of Chicago, where we know residents haven't had the same access to care and resources as our neighbors. The SSHCO is a nonprofit organization funded by the state of Illinois' Health Transformation Initiative and created to improve the health of residents on Chicago's South Side. 13 healthcare partners, including hospital systems, safety net hospitals, and clinics, have come together to provide better access to healthcare and services to Medicaid and uninsured residents on the South Side of Chicago. What this means is that we are using these state funds to add more doctors, nurses, and specialists in the community to increase access to care. We are also hiring and training community health workers and nurse care coordinators who help patients and residents schedule doctor's appointments and manage their health conditions like high blood pressure and diabetes. Additionally, we can screen patients to identify their social needs and connect them to resources within the community to get their needs met. And last, but certainly not least, we are excited to be connecting our 13 provider organizations through a shared technology platform to improve care coordination. There is so much going on at the SSHCO these days. For instance, we just hosted our very first community empowerment health fair, which was the brainchild of the SSHCO Community Advisory Council, who volunteered countless hours and pulled off a highly successful event just 3 weeks ago. I truly enjoyed moderating a panel focused on mental health needs on the South Side and what SSHCO, and with SSHCO, the Chicago Department of Public Health and our provider partners are doing to help meet these critical needs of mental health. You'll hear more highlights from the health fair from a member of our CAC in just a few minutes. SSHCO continues recruiting administrative and care coordination staff, including community health workers and nurse care coordinators. Over the past 2 months, we have hired an additional 25 care coordinators and remain focused on making sure we provide our staff with the support and training they need to excel in their role and serve the community at the highest level. You will hear more about the training program later this morning as well. All of the work we do is driven by community need, and we have seen how critically important it is that we not only treat illness and have regular checkups, but also to focus on and invest in having fundamental needs met, including healthy food, transportation, employment, and stable housing. These are social determinants of health, and they make a huge difference in the health and well-being of individuals, families, and the community. And so, to address one of the social determinants of health, the SSHCO has invested some of our state transformation dollars in the flexible housing pool, which draws funding from the City of Chicago, Cook County, and the state, as well as hospital systems, managed care organizations, and collaboratives like ours to increase supportive housing resources in Chicago and Cook County. More to come on the partnership with the flexible housing pool. But first, let's hear from one of the patients benefiting from the SSHCO services.
I found out about you guys through Anita Jackson. She's with the health coordinators at TCA Health. Helped me with fresh fruits and vegetables. They've helped me with like psychiatric stuff.
Mhm.
I have real bad asthma,
Mm.
and I really didn't take it as serious as like me having the conversations with Anita and like actually having that support because I didn't have the support at the time. But with her being there to be my support, it actually helped me. So like now I'm able to manage my asthma a little bit better. She helped me set appointments for like my doctor's visits, um, set appointments to talk to my psychiatrist. You guys are help definitely with the community wise because there's a lot of people, especially like I know a lot of people that's homeless or that actually need like help. Like I'm one of the people that actually needed help. And some people just are not able to ask for help. Help me go through my little journey and help me live, like to be able to do stuff. So it's like, would I recommend it? Absolutely. Absolutely.
Wasn't that patient testimonial wonderful to hear? Thank you, Marshawn, for sharing that powerful testimony. Yes, we all can use a little help sometime. I want to quickly remind everyone that if you have any questions, please start putting them in the chat directed to Melanie Waller. We will have plenty of time for Q&A in the second half of the town hall meeting. And now, I will turn this over to Dylan Azadi, one of our Community Advisory Council members, to share highlights from our recent SSHCO Health Fair. Dylan?
Thank you, Kimberly. Good morning, everyone. My name is Dylan Azadi. I'm one of the members, as Kimberly mentioned, of our Community Advisory Council. So I'm excited to be here. And I want to quickly talk a little bit about the health fair that we recently sponsored and hosted. So just some general highlights about it. It all came to fruition as a result of brainstorming in our Community Advisory Council. We broke out into different subgroups and we started some brainstorming and ideation, ultimately decided on the key topics that we wanted to feature and the types of vendors that we wanted to participate, giveaways that we wanted to hold, special events, music, and things like that. So it all kind of started here within the Community Advisory Council. Okay, and I think overall it was a great success. So we hosted it, by the way, at the Kroc Center. This is the Salvation Army Kroc Center down on 119th in the West Pullman area. Which is a great partner of ours, and hopefully we can do another, hopefully several more events there in the future. So you can see some highlights on the numbers here, almost 100 attendees, including us, and 11 vendor tables, which was pretty awesome. So, okay, let's talk a little bit about promotions. So this was a big deal to try to put together, especially on short notice, and we wanted to make sure we got the word out all across the community, all across the South Side. So the way we went about that, first of all, it's largely thanks to Tembi and Sharika, two of our program managers here at SSHCO. They were instrumental in the planning efforts. We couldn't have done this without them. We also had our communication partner, which is JT Gold Star. So we had folks from our comms team doing outreach. You can see that we've got a newsletter publication here. We did some videos. We did even a radio spot, which was pretty cool. Social media, we really tried our bit out and make sure that everybody felt welcome to attend. So this initial, sort of our inaugural educational empowerment health fair, we chose to do behavioral health and mental health as one of our feature topics. That is the subcommittee that I'm actually part of. And part of that topic was we wanted to put together an expert panel and have a few leaders and experts in the behavioral health space speak in a moderated panel where Kimberly Hobson, our CEO, was asking questions. The audience was able to ask questions. It was very collaborative. It was an extremely insightful and engaging discussion, and there were some very powerful stories, including some community member patient testimonials. So it got a little emotional at times, but it was beautiful, and it was really well worth it. And I think it helped a lot of people, including myself. Just to highlight the folks who participated in that panel. So it was Dr. Ige, who is the Chicago Department of Public Health Commissioner currently. Also our CAC Council Chair and also General Surgeon at Sinai, Dr. Heron. And then we also had Nita Marchand, who's a behavioral health specialist at Beloved Wellness Center. Okay. And quickly, just to highlight the vendors that we had participate, again, we had 11 vendor tables, which was pretty impressive. We did everything from educational materials and handouts to resources that people might need. There was, I believe, HIV testing available free on site. There was also how to check your blood pressure, all kinds of stuff that provided a ton of value, information about food and transportation, a lot of the services that SSHCO provides that folks may not have known about that we wanted to get out there. We also had a hiring team for SSHCO jobs. We had signups and registration for SSHCO services to bring more members into our community if they were eligible, and so on. And the family fun and giveaways. Giveaways always the best part. I think we did a great job at that. There were a ton of giveaways. We had some of our CAC members who were able to leverage their connections and their networks to get diapers and wipes, food items, all kinds of stuff, cleaning products for the home. So this was, I thought, a really powerful aspect of the event. We gave away a lot of stuff. We also did some really cool Zumba classes. We did a yoga class. We did some face painting. It was really fun. We had a good time. It was serious, and we covered a lot of very important information, but we also had a lot of fun. So I think it was overall a very successful event. And again, I hope we do it again many times. And I think that's it for our health fair event coverage. So now I actually want to hand it over to Dr. Heron, who I mentioned earlier, Dr. Bernetta Heron. She is our CAC Advisory Council chairwoman. So she's going to share with you some updates on new members joining our council.
Hey, thank you so much. It was really exciting to relive that. A beautiful event. It was very exciting. A lot of work to put together, but it was wonderful to see the fruition of our goal and our vision. I also want to thank you, Dylan, for your work on the council and the behavioral health subcommittee. And at the fair, you were such a wonderful MC for the event. I also want to thank and acknowledge the other volunteers from the organization, community, and from our council who spent countless hours making the health fair really a wonderful event for families and the community. And I also want to congratulate our council because it was a mission that we were able to accomplish, and we're excited to grow from there for further events in the future. And I think it was a great accomplishment for our first year. So we recently completed a round of applications for our new Community Advisory Council members. I'm really pleased to also note that more than half of our current council has agreed to stay on for a second year. And so now that our council has both grown and extended into the community, and so the new cohort that we're bringing in for the council will have a 2-year term. And instead of 15 members, we will now have 18. So I wanted to introduce our new members and to tell you a little bit more about how they represented to us why they wanted to help the Southside community in this manner. So Brian Alexander with Project Hood is driven by his commitment to improve community well-being through accessible healthcare and addressing disparities. Darius Anderson with Kenwood Oakland Community Organization aims to revitalize neighborhoods with healthier food options and combating systemic disparities. Dee Atkins with Thresholds is a passionate advocate for diversity, equity, and inclusion, dedicated to enhancing well-being on the South Side. Ronald Campbell with the Southside NAACP is dedicated to equity and health in all aspects of life, and also has a background in nursing and hospital leadership. Next slide, please. Tessa Clark, who is retired, has dedicated her career to serving vulnerable populations in Chicago and advocating for community health and wellness. Guy Fuller with All Star Partners wants to close the health equity gap by leveraging his technology expertise. Sunny Kadesh, a clinical graduate student at University of Chicago, is passionate about bridging gaps between communities and health systems. And Jerry Mack with the University of Illinois is dedicated to improve health equity through community collaboration and advocacy. So obviously we have a very beautiful group, very dedicated people and very driven people. We look forward to working together. I think it's going to be a great next couple of years with our new council members, focusing on community needs, and bringing community voice consistently to, through, and from the SSHCO. And I welcome you all, and I'm looking forward to working with you.
I think that's my cue. So thank you so much, Dr. Heron, for sharing the pictures and the information on the new CAC members. Thank you to all the returning and new CAC members, as well as our employees. My name is Stephanie Barnett. I'm Director of Human Resources here at Southside Healthy Community Organization. And I just want to remind everyone that you are also welcome to join our team and help to fulfill the mission in servicing the Southside of Chicago residents. So we are hiring for several different positions, including administrative positions such as a part-time CMO role, Director of Development, Manager of Information Technology, and also an Executive Assistant. We are also continuing to grow our care coordination team members. So we are looking to fill several additional community health worker positions, community health outreach worker positions, LPN and RN nurse care coordinator positions, as well as supervisors for those roles. All full-time employees are eligible for benefits such as medical, dental, vision insurance. We do have a 401k with an employer match. We have SSHCO benefits such as life insurance, short-term disability, long-term disability, a very healthy PCO program, wellness programs, and also offer education assistance by way of tuition and student loan reimbursement programs. And we do have a very comprehensive benefits package. So if you were to go to our website, you can see all of these positions, apply for positions, refer qualified candidates to positions, but also see a list of all of our benefits that we have to offer. If you have any questions in regards to our hiring, please feel free to go ahead and put it in the chat and we can address that during a Q&A. Or again, you can go directly to our website at www.southsidehealthycommunity.com to see more information. And without further ado, I'm going to transfer it over to Sharika House, who can tell you a little bit about the lovely training program that we have for our care coordination team.
Good morning, everyone. I'm Sharika House, the Manager of Training and Community Partnerships here at the SSHCO. And today I'm excited to share more about our SSHCO University program. The university was launched this year to provide learning and development opportunities to new and existing staff within the SSHCO, and ultimately to our community partners as well. All new hires are oriented to the organization through our SSHCO University in collaboration with our Human Resource Department. And today, just to share more, our SSHCO University is a care coordination learning and development program equipping healthcare professionals to receive patient-centered and culturally responsive training opportunities for the purpose of providing equitable, high-quality care and services to residents on the South Side of Chicago. And as we move forward, I'll share a little bit more about our mission and vision. The SSHCO University was built on an innovative learning model that emphasizes a shared learning approach, meaning all participants will actively engage in their own learning process. So it's our mission to fully prepare our care coordination staff and other healthcare professionals through our evidence-based research and industry standard best practices to engage in a patient's wellness journey. And as we continue to dream big, our vision is to become the standard for healthcare learning and development training on the South Side of Chicago. And our vision and mission continues to influence our 5 key pillars of the SSHCO University, which is people-centric. We're equipping our staff with skills and talents to become successful in their roles and continue to grow professionally. We're nimble, meaning that we have built in-house custom trainings and course offerings designed to fit the needs of the staff. Our trainings are bi-directional, which allows for mutual shared two-way learning. It's impactful. Our goal of impacting the health outcomes of our patients and achieve their optimal health levels. Ultimately, we are training to transform how healthcare is delivered and received on the South Side of Chicago. And as we talk about our pillars continues to influence our core components of the SSHCO University. And our core components within the SSHCO University is core skills advancement, developing and enhancing competencies of the participants operating within the various healthcare settings, our care coordination, developing participants to engage with patients, identify and assess their needs, link to primary care services, build individualized goals, and support patients to become self-sufficient. Ultimately, as well, our community collaboration, which is our opportunity for our experts within our partner sites, our CBOs, and the community to collaborate on training staff within the SSHCO. As we continue to collaborate with our partners as well, Sinai Health and UCM, for ongoing training and learning collaboratives as well. And we look to our partners and Community Advisory Council to continue to cross-train on various healthcare disciplines, on various chronic illnesses, comorbidities, and to learn how to bridge and fill healthcare gaps, lessening the burden on our physicians while increasing access to social resources and ultimately improving access to quality healthcare. And as we continue to talk about our core components, it also influences our current course offerings, which are our new hire care coordination skills program, our care coordination clinics, and our grow coaching and mentoring program that we're set to launch towards the end of this year as well. And just a little insight, our new hire training course is a 2-week in-depth hands-on training designed to orient and advance new hires within the profession of care coordination. And we have fun learning how to engage with patients, identify and assessing those needs, continue to link to resources, and prepare our staff to integrate within our ED settings and our medical homes as well. Our core skills clinics, which is our care coordination clinics, are our lunch and learn opportunities set to launch this year as well for existing staff to receive ongoing training and support. The clinics will be facilitated by our internal staff and collaboration with our external partners. And last but not least, our grow and coaching and mentoring program is exactly what it says. We want to grow our staff. We believe in our staff and desire for each person that joins our organization to become successful. Our grow program will support staff facing barriers to reflect, reset, and reignite their desire for the work they were hired to do. So just in closing, just wanted to share some additional outcomes here. At the SSHCO University, we have trained thus far 20+ individuals that have entered into our organization. And just some commentary shared by those individuals that have participated in our training have stated, my new hire training exceeded my expectations. I felt included, seen, and poured into during my training class. Additionally, my new hire training taught me core skills management I didn't receive in nursing school. This is a reminder here that within the SSHCO University, we are providing the right trainings to the right people, equipping them to do the right things at the right time in a patient's journey to wellness. And I'm excited for the SSHCO University to continue to grow and welcome new hires in this space. And in closing, I just wish to reiterate Stephanie, our HR director, that stated, we are continuing to hire within the organization. If you desire to make the SSHCO part of your career path, you can expect to receive a robust training experience through our newly developed SSHCO University. Be sure to check out our website for new updates and offerings. Thank you.
Thank you so much, Sharika and Stephanie, for that. We hope that you will share this information with your friends and neighbors who are looking for meaningful careers where you can really make a difference in your community. And so next up is Dave Thomas. He's the Senior Director of the Center for Housing and Health. as part of the many services SSHCO provides that address the social determinants of health. We have invested in the flexible housing pool to provide stable housing for up to 95 families. And so here's Dave to tell us more.
Thank you, Kimberly, and good morning, everyone. It's a pleasure to be here. The Flexible Housing Pool is a program administered by the Center for Housing and Health, which I'm obviously employed by, and super excited that we can partner and provide housing and services to folks in the SSHCO who need housing and other supports. And as Kimberly said, SSHCO has invested in housing up to 95 individuals or families over the next few years. And I'll give you some updates on where we're at with that in a minute. But just so everyone understands what the Flexible Housing Pool is, it's considered what we call a supportive housing program, which means there's two core components to it, where folks are provided a tenant-based subsidy. So we work with private market landlords in the community, and once individuals are housed in that unit of their choice, the client pays roughly about 30% of their income. The program pays the remaining portion of the rent directly to the landlord. And then along with getting the housing subsidy support, we also have intensive case management, or sometimes we call it tenancy case management or housing supports. And the case managers have no more than 20 people on their caseload, so they can provide intensive services. They're going into people's homes. It's not just office space. They're going into people's homes to make sure that their housing situation is stable, safe, clean, and that they're managing being in a unit sometimes for the first time in their lives. The goals of the Flexible Housing Pool are to increase housing stability. So making sure that it's not just short term, but making sure that people have a long-term solution to ending their homelessness. Increasing income. Our case managers work really hard to help people focus on either access to benefits or gaining employment if they choose so. And then improving their health outcomes. And obviously that's where we work pretty hand in hand with care coordinators, community health workers within the SSHCO to make sure folks are connected to primary care and other services that they may need. SSHCO refers clients into the Flexible Housing Pool. Folks are first identified through community health workers or at a clinic or such. And within that internal process that SSHCO has, once somebody is identified to be eligible for the Flexible Housing Pool, they're then referred on to the Center for Housing and Health. We administer the program, and then we have, it's actually 3 case management agencies. My apologies that I left one off here. But we work with 3 subcontracted housing agencies: Chicago Family Health Center, which is a part of SSHCO, Holistic Alliance, and then Of Color Inc. So my apologies to Of Color Inc. for leaving them off here. And then the subcontracted housing agencies provide the long-term housing case management services once they're referred into those agencies. And some of the services at a really high level of what's offered to anyone who comes into the Flexible Housing Pool is we have a team of outreach that goes out, ensures that the individual is eligible for the program, and then brings them into the program essentially and helps enroll them into the program. And then we have landlord engagement specialists who work behind the scenes to identify and get new landlords into our program portfolio. We have over 200 landlords. Then we have the housing location services, where a housing navigator helps the client move into one of those units of their choice at the initial stage of housing. And then I mentioned the long-term case management. There's no cutoff for that time. Clients have the case management as long as they want and need it. And then we also offer things to help people get situated in their new unit or their new home. So helping them get furniture through the Chicago Furniture Bank, having move-in startup kits, so everything from hygiene items to household items. So folks have kitchen utensils and pots and pans and a shower curtain for the bathroom and so on. And then there's a client assistance fund. Sometimes, life is unpredictable, and so each of the agencies have a client assistance fund to help folks if they run into some crisis that helps stabilize their housing. And this is essentially kind of the step up into the program. We have folks who are referred to us who come with all different types of backgrounds in terms of their homeless status. They may be unsheltered, they may be coming from a shelter, they may be doubled up. We see folks who range from needing housing or that brought them into homelessness because of maybe their chronic health conditions and they couldn't keep a job, and so they lost income, they lost their home. We see folks who are fleeing domestic violence coming into the program and giving them back some stability and dignity in their lives. Sometimes mental health and substance use issues play into folks losing their housing and becoming homelessness. So we have a range of folks who need us, and so we don't screen out people, we try to screen in people who are referred to us. Then I mentioned, the program in and of itself and sort of the key steps of referral, outreach, and the housing search are sort of the initial services offered to clients to get them starting to be situated in the flexible housing pool. And then again, once folks get housing, they can do all sorts of things. They don't have to worry about a roof over their head anymore, and they can start to stabilize themselves with the support of the housing case management, with a connection to the care coordinators or the community health workers and primary care. And I mentioned some of the things like the rent subsidy is there as long as folks need it. And we just want to make sure that folks are getting referred to other services too. So our case managers refer folks to community-based resources for basic needs such as food, clothing, things like that, all the way up to connecting them with mental health services, DV services, HIV services, in conjunction a lot of times with SSHCO staff. But the case manager, again, probably sees a client 2 to 3 times a month. And so it's really important to engage them that way. And just some really great stats, and this is actually even updated from when I created this slide a week or two ago. We actually have 27 households housed as of today, so we're really proud of that. It's about less than a third, if I'm doing my math right here. And we have some folks in pre-housing, which means they've already been eligible for the program and they're looking for their first housing placement. And we have a few people in outreach who we're trying to connect with to bring them into the program. So we're super excited to finally have launched the program back in April and already have 27 housed individuals housed and families housed for the program.
Thank you, Dave. Appreciate that update. That's a really amazing work that we're doing. That concludes all of our feature topics for the day. So we're actually gonna roll into some Q&A now. So any folks who have submitted questions through the chat, we'd like to address those now. Okay, it looks like we have a couple of questions, about 6 or 7 so far. Okay. So let's start up top here. So this is from Sarah, Melody? Or we're going to direct it to Sarah. Sorry.
Directed to Sarah.
Oh, perfect. Thank you. Okay, so the first question, does the organization have a dedicated committee focused on COVID as well as long COVID? If so, what is the focus and how do I connect with the leaders? So we're going to direct that to Sarah, please.
Hi, good morning, everyone. Thank you for that question. In our current state, we do not have a dedicated committee focused on COVID and the impact and implications of COVID from a long-term standpoint. We have had patients that have experienced the symptoms related to COVID and the long haul symptoms related to COVID in the past that we've helped to connect to primary care services and those other health-related social needs to continue on their journey of improved health. But we don't have a specific focus on COVID and the long haul symptoms related to it.
Thank you, Sarah. Okay. Number 2, we've got mental health first aid. So asking about the mental health first aid curriculum. Is that part of the SSHCO University training? And this is for Sharika.
Good morning again. Regarding the mental health first aid training that is available to our staff through our partner site, SUHI, which is Sinai Health, and staff will have access to complete that training within the first 90 days of their start date.
Thank you, Shrika. All right, the next question is evidently for me. So this is what do you think was the best part of the health fair? That's a difficult one to answer. The whole thing was really amazing. I think ultimately it's connecting directly one-on-one with the community members, and seeing, at the ground level, the impact that we're able to make if we really lean in and try. I thought that was the most powerful and compelling aspect of the health fair, just shaking hands with people, meeting people and their families, getting to know them and their needs and their challenges and how we can help. Next, can you please elaborate on your mental health services and how do we access them? Who would be best to take this one?
I can start, Dylan, and if anyone else on the team wants to add. So our mental health services include the support of our community healthcare workers and nurse care coordinators, navigating those patients to those services around mental health, whether it be a physician or a community-based organization that's helping to support the members that we work with. Those team members also help to support the patient with navigation to those social resources that also have impacts on their care, and help to establish patient-focused goals with that patient, to set those goals throughout their care coordination and journey, and are meeting with them quite frequently to ensure that they're working towards meeting those goals. Our services also include helping to improve access to psychiatric care, and that is done through the work we do with our partner organizations and helping to subsidize additional providers to improve access for those services within the community. In the current state, patients can access those services through our partner organization. So a patient that is going to one of our provider partners for their services, or if we engage with the patient out in the community or in the emergency department, and they're asking for support and seeking support to be connected to a provider, we're helping to connect them to those services in that fashion as well.
Awesome. Thank you very much once again, Sarah. Okay, we're going to keep rolling here. We've got a good amount of time left, so let's take as many as we can. Eligibility requirements for housing, specifically for the flex housing model. Who would be best to address this one?
I'm happy to take that unless someone else wants to.
Dave, you can start.
Sure. Yeah.
Thanks, Dave.
Thanks. The flexible housing pool is pretty low barrier, and so we want to, like I said earlier, screen people in rather than screen people out. So the basic eligibility is that someone is unsheltered homeless. They could be living in a shelter. They could be doubled up, as long as they identify as having an unstable housing situation. If they do not have a lease in their name, but they have some other unstable situation, that is part of the eligibility. And then we also look for folks who have been visiting the emergency rooms or hospitalizations numerous times over the course of the last year or so. And so we look for folks who have pretty chronic conditions that lead them to those situations. And so between those two core eligibility, those are the two core sort of eligibility criteria. And folks are identified usually through their community health worker or a care coordinator. Thanks.
Thank you, Dave. All right. Can community health workers, or CHWs as we call them, who work with SSHCO, can they refer patients to the flex housing pool? And secondarily, does the case management come from the pool or the administrator or from SSHCO directly? So Dave, would it be okay if I pass this one right back to you?
Sure, absolutely. Yeah, so the like I think I just mentioned that the care coordinators can make the referral into, I think Lashina handles all of the referrals sort of on a coordinated basis and then sends up to the Center for Housing and Health. And then the case management is provided by our subcontracted partners, so Of Color Inc., Holistic Alliance, and Chicago Family Health Center. Did I get all the questions there?
I believe so.
Yeah,
Yeah,
I
thank you,
just
Dave.
want to add, looks like there is also part of that question is specific to our community healthcare workers that we work with through UCM. Those community healthcare workers, as well as our partner organizations, have the ability to make referrals to our community healthcare workers for patients that they believe would fit the criteria for support through the flexible housing pool. And our team members can work with them to fill out the documentation that's needed to facilitate that referral over.
Thank you, Sarah, for that context. Okay. How can I apply for the jobs you mentioned? We mentioned SSHCO is hiring and did some hiring promotion at the health fair that we hosted. So how can folks apply, Stephanie?
So all of our available positions are listed on our website. So you can go to southsidehealthycommunity.com and see all of the positions that are available and apply as well. I am also including the link in the chat if anyone wants to copy and paste it or use the link to access our website directly.
Thank you, Stephanie. All right. Are there any demographics on patients who are served by SSHCO? For example, the average age of somebody that's in the SSHCO pool. This will be for Sarah, please.
So for the average age of current patients that we're helping to support and community members, they fall between the age ranges of 25 and 44 is the average age that we're seeing. I would say it's almost at a split even between male and female that we're helping to support, and majority of the patients live within our region, the south side of Chicago, as well as we do track race and ethnicity to understand as well where we might have opportunities around communication and developing different communication tactics for those particular populations. And right now, the vast majority of the patients that we help to serve are African American.
Got it. Thank you, Sarah. Do any of the housing options include on-site mental health support services? We'll go back to Dave for this one.
Sure. So all the housing that is provided to the folks in the flexible housing pool is scattered site, meaning it's all private market units with private market landlords. So there's no agency-based housing, but our case managers are pretty adept at helping folks get supported to any mental health services that they may need through SSHCO. So our housing case managers are trained on SSHCO and the system, and so know how to and where to connect folks back for mental health services.
Thank you, Dave. Okay, next is, do any of the SSHCO resources respond to needs related to weather challenges, emergencies, and so on? This person, it sounds like, was thinking, of the tornado warnings that we all got last night and some of the damage that was caused. Any assistance or response related to weather crises?
I'll jump in on that one. And so we do not have specific programming or to address weather-related challenges. I will say that many of our staff are deployed out into the community. So they're employed into our hospitals, into our federally qualified health centers and so forth. And I would think that if they are in those sites, they would have some opportunities to guide individuals in the right way. And so, no, not a specific program, but we do have resources in place that we can refer individuals to where they need to go to get the help that they need.
Thanks, Kimberly. If we could be FEMA, I'm sure we would, but we cannot.
And you know, some of these things, I'll just jump in again. Some of these things that end up being weather related could be things like people need food because, you know, their refrigerators are off and things like that. Those are social determinants of health. Those are things that we can directly help individuals with. So there's a variety of needs that people may have related to what went on last night. But we will find the help that people need if we don't deliver it directly.
That's a great point. Thank you, Kimberly. Okay, a couple questions left. We've still got about 5 minutes before we wrap up. So next question, do you have any projects that the members or myself with DEIA, so that's diversity, equity, inclusion, and accessibility, any projects for folks with DEIA experience and or public health experience can volunteer to participate? We'll go back to Sarah for this one.
There's no shortage of work. I'll say that. And we have a number of initiatives that we have taking place. We have taken on interns in the past to help support some project-based work. And that's where we might have opportunity for volunteer assistance. But I would ask that you just contact us directly to better understand what that could particularly look like.
Yeah, I'll add to that. Thank you for that, Sarah. You know, in one of our last meetings, we were also asked about volunteer opportunities. And so at that time, and I'll say it again, is that I do believe that as we move forward, as Sarah mentioned, we have these we've had some individuals come in and help us with projects and that, but I really do foresee in the future the Southside Healthy Community Organization having a volunteer arm of the work that we do. And so we will have a program where, you know, residents and so forth can volunteer to work with us in various different ways. So I see that coming. We just don't have a formal program at this time, but as Sarah mentioned, I would suggest you reach out to us directly and we can have a conversation about what you're interested in.
Thank you, Kimberly. Thank you, Sarah. Okay, just a couple minutes left. I'll try to go quickly. So SSHCO University, another question about that. Looks like the next two questions are about that. How does it coordinate with the community colleges across the South Side? Sharika.
Good question. Currently, we do not have any active partnerships at this moment, but we are actively building and pursuing an apprenticeship program. And so we are looking to build a pipeline for newly educated community health workers, LPN, and nurses to come on board at the SSHCO beginning in 2025. And so more information to come on that. Good question. The next question looks like who are the current partners and who's eligible to apply to the SSHCO University. Currently, you do not have to apply. If you are a new hire or an existing staff person within the SSHCO, you are eligible to participate in any of our trainings moving forward. But we are absolutely interested in partnering with some of our community-based organizations and our partner sites as well to provide ongoing trainings. And if that's something that you are available for, definitely reach out to us at the organization to collaborate moving forward. Thank you.
Thanks, Sharika. It looks like two questions down is another one for the university. Is it a paid training program?
Staff that are hired within the organization, they will receive their standard rate. And so they are paid to participate in training.
Awesome.
And they start that training,
Thank you.
we should say that they start that training once they are hired. So once
Absolutely.
they're hired, that is part of their training as they come into the organization.
Excellent. Okay. For MCOs or managed care organizations, sounds like we have a representative one, a Medicaid MCO here in the chat, and would love to participate in the health fairs. Last time they received the invitation a little too late for to be able to submit to HFS for approval. How can we engage the health plan so that we can get this information out sooner? It's a great question. Yeah, we were under a little bit of a time crunch, I think, to get this first one out. But we do, I think we've learned a lot of great lessons with the first one. So I'm confident that the future ones that we host, if and when, will be a lot more crisp with the communication and advance notice and planning and things like that. This is sort of our guinea pig, so to speak. So I'll let maybe Tembi or Sharika provide any other comments on that.
I think you hit it on the head. Definitely, we look to continue to grow and partner with our MCOs moving forward, and we'll ensure that we have advanced notifications and opportunities to communicate in the future. Thank you.
Absolutely. Yeah, health plan engagement. We'll make a note of that specifically in addition to the providers. Okay. Looks like we have one left before we wrap up. So I think we already covered this one. Housing options, Dave, including mental health services and case management, care management on site. I think we covered that one, right?
Yeah, the one other thing I would add to that is, even though it's not on site, our case managers definitely try to connect people with transportation services to get to the needed services. So that's, we try to provide or break down as many barriers as possible, and we definitely can provide transportation to services. Thanks.
Thanks, Dave. And that lastly one is the housing pool. Do you have to reside in a certain area to be eligible for the housing pool? I believe we may have covered that as well, but if you could just quickly.
Sure. Yeah, you're eligible if you're referred through the SSHCO, and we try to give client choice to where folks want to live, but making sure that they're connected with services as easily as possible too. Thanks.
Thank you. Thank you, Dave. All right, I think we're ready to wrap up. I think we're perfect on timing. So 4 minutes left, Kimberly, if you wouldn't mind sending us home and letting also folks know how they can submit any future questions or anything we weren't able to cover live today.
Yeah. Thank you so much. Thanks everyone for your questions, and thanks to the speakers for sharing your highlights about the work of the SSHCO. If there are additional questions, you can always go on our website at southsidehealthycommunity.org and submit those questions. I just wanted to thank all of our speakers for sharing, for talking about the things that you are doing to support the work of the SSHCO. I'd also like to remind everybody that Medicaid patients and those without insurance are the population that is served by the SSHCO. So if you or someone that you know is uninsured or insured by Medicaid, please get connected to us. There are two easy ways for you to do this. One, you can ask the SSHCO services and community health workers at one of our 13 partner site organizations, or your primary care doctor may direct you to the services as well. Another option that you can use is you can go to our website, which is southsidehealthycommunity.com, scroll down just a little bit and fill out a brief form about after which one of our staff members will reach out to you once we've got the information from that form. And please, one last thing, please continue to follow, like, and share the SSHCO on our social media platforms in Facebook, Instagram, and LinkedIn. And so once again, thank you all for joining us this morning, and have a wonderful day. We'll see you the next time.